So when we talk about diseases, that was where I started with talking about those pathology, general and systemic pathology. And when we talked about general pathology, I was talking about diseases and processes that are not specific to any part of the body. We are talking about processes that happen across all parts of the body. And so when we say something is general, it means it's something that cuts across um, all the body, the processes that other parts of the body are going through. That is not peculiar to just one organ or one tissue or not. And when we talk about, when you have this in mind, you'll be able to compartmentalize, or let me say stratify and break down different diseases. You'll be able to deconstruct different processes that are happening in the body, such that when you want to, anytime a terminology that you understand comes up, the first thing that you'll be able to know is for you to be able to determine whether this is a systemic or general pathology is this process, you first ask yourself a question, is this process peculiar to this disease alone? Is this process something that only this particular type of tissue undergo? So if it's something that is peculiar to a class of tissue only, then that is not a general pathology. That is more likely to be systemic pathology. And which means we have some processes that cut across, we have processes that cut across all the human systems, and we have processes that are peculiar to particular tissues and particular organs. So that is the essence of you being able to understand differences between the various diseases. And which means when we are talking about stuff like inflammation, then that is a type of general pathology. When we are talking about inflammatory responses, then that is, you understand that what we are talking about is not something that is just peculiar to a specific disease alone. So general pathology refers to processes that happen across all the tissues. So that is one way to look at it. And we always say that even though cells are different, even though cells are non-specific, even though the cells are the building blocks of the human body, they are still, even though their brain cells and liver cells are different because of the type of function that they perform, they are also similar because they are cells as it is. And so that is one angle to look at it, which means even though some processes are peculiar to the brain function, but because they are also cells, they still share some similarities with other cells in other parts of the body. And so those similarities that they share with other parts of the body, and those similarities that influence their actions, the way they multiply, the way they survive, and the way they increase in number, those processes are referred when there is a disease process in action, then those processes will generally come into play under the purview of general pathology. So, so one way to look at it, I've gotten to where I want to share with you guys. One way to look at it is, so everybody can look at your screen. So one way to look at it, please, like I said, look at your screen now. So when you want to define general pathology, pathology by definition is the study of the structure, biochemical and functional changes in cells, tissues, and organs that underlie diseases. So there are different ways to look at it. In chemical pathology, the focus on the chemical aspect of the tissues, because there are different tissues in the body and there are different components in the human tissues that we look at in different sections, in different parts, in different laboratories, in different units of medical laboratory science. So there is a microbiologic aspect, there is an immunologic and morphologic aspect too. So when we look at in histology, we are really, really particular about the changes, more specifically about the morphological changes. How, okay, what Faith wants to see something. Sorry. Wow, so many hands already. Okay. Faith, what's up?
So please, you're too fast.
Ha.
Jesus. You're rushing. I can barely even hear what you're saying.
Use earphone. Do you have earphone? Go and get your earphone. Get earphone. Rosaline, I think Rosaline has been lowering her voice. So if you cannot hear me clearly, use headphone. It will sound more better, because I think you'll be conflicting the confusions, the noise around you, and it will be making it difficult for you to concentrate. So please get headphone. So back to what I was saying, I'm just trying to go through what we've already said. So one of the things, remember I said, if you want to look at the disease processes, for you to be able to, what's happening? Okay. For you to be able to understand to convincingly say that you understand every disease that we are talking about, several elements are important. For instance, so we have the various disease process. You understand the first thing that you need to do when you're trying to study a disease is understand that what is the cause. So I'm highlighting something. If you're looking at your screen, I'm highlighting something that is that what is the cause of this disease? That is the etiology. So the first important key element of any disease that you are talking about is what is the cause? What is the etiology of that disease? What is the cause of that disease? And I said malaria, for instance, is caused by Plasmodium falciparum. So that is the cause of the disease. Then the second thing is the pathogenesis. Pathogenesis talks about the biochemical and molecular mechanisms that lead to the development of that disease. When we are talking about pathogenesis, it's just like you're looking at the steps involved that will now lead to that particular disease. So that is what the pathogenesis is talking about. So pathogenesis talks about the biochemical and molecular mechanisms of disease development. So the first thing you know, the cause. What is the cause of this disease? The second thing is the pathogenesis. How does the disease arise? What are the different elements of the disease that would come in to lead to that disease? Let me give you an instance. When you want to talk about fever in malaria, what happens the processes that result in fever in malaria is that the Plasmodium falciparum invades the red blood cells, and the red blood cells will now destroy the red blood cells, releasing foreign chemical substances into the blood, and the body will now see these foreign chemical substances, these substances that are released into the blood circulation, as foreign items that the body must get rid of. So in an attempt to get rid of those substances, body's temperature increases, and that is what presents as fever. So that is the way you can understand pathogenesis. That is what we want you to describe. We want you to describe pathogenesis. That is what we want to particularly hear about. If you want to discuss the pathogenesis of HIV, what happens is that the virus attaches to the CD4 receptor on T cells. And once it attaches, it enters the immunologic cells, hijacks the mechanism of the immunologic cells, and directs the body cells to produce substances that the virus needs for its own growth. So that is the pathogenesis of HIV. So whatever disease you are trying to discuss, so that is how you are going to describe it how the disease progresses from one point to another. So we've discussed the etiology, the cause of the disease. We've discussed the pathogenesis, how disease arise. And the next one is morphologic changes. The morphologic changes is that now that the disease, or the causative organism has established itself in the host, how does that presence of a causative organism, how does it bring about the disease? What changes does it result in the cell or in the organ of the host? So what am I trying to say? For instance, we were talking about, if you remember, hypertrophy, atrophy. These are morphologic changes in the ideal structure of the cell. For instance, there are some in liver cirrhosis. Liver cirrhosis talks about an aberration of the liver. And so those aberrations, what changes? There is a normal way that the liver cell is going to look like. But when a disease is in progress, especially a specific disease, the structure of the liver cells would be altered. So those changes what will be captured under the morphologic changes. So we've known the cause, we've known the pathogenesis, and we've seen the structural alterations. So morphologic changes. So those are the first three. Then the last four aspects of disease is the clinical manifestation. In clinical manifestation, what we are interested in is that now that the disease has been established, how does it present clinically? For instance, what are the symptoms that the patient will suffer from when these changes arise? For instance, look at the reason why you guys are at home, coronavirus. What do you think is the clinical manifestation of the disease? Who has an idea? Let me raise up your hand if you know the clinical manifestation of coronavirus disease. Nobody.
Fever.
Yeah, but it's not specific. What other stuff do you know? What other clinical manifestation?
Coughing.
Coughing, right? Okay, still that's
difficulty in breathing.
Difficulty in breathing.
Pneumonia.
Yes. What else?
Pneumonia.
What else have you heard that you think is remotely linked to coronavirus disease?
Pneumonia.
Pneumonia, yes. Rosalie, what do you want to add? Benedicta, what do you want to add? Then just allow your
Hygiene.
What do you also want to add?
Poor hygiene.
I didn't catch that. What did you say?
Poor hygiene, bad hygiene.
Okay, I'll take it, even though I struggle to hear that. Now, so everything that you've mentioned are the clinical manifestations of the disease, of this particular coronavirus. So then let's also talk about another, who can also tell me another disease and the clinical manifestations of that disease. So raise up your hand if you know an entirely different disease and its clinical manifestation. Any disease now, I'll take any disease. Anybody? Okay, let me be more specific now. Okay, Akinjosoye here. So tell me any disease and its clinical manifestation. I know we are listening.
Yes, sir. Hello?
Hello, I'm here. We are hearing you.
Cancer.
Cancer. What type of cancer? You have to be very specific because cancer is a very brief.
Cancer.
Okay. So what are the clinical manifestations of cancer?
Loss of air.
Okay.
Loss of air.
Okay, loss of hair. That is
loss of weight.
Okay, loss of hair, loss of weight. Yes. But yeah, that is very good. But the reason loss of hair comes in when a patient is under chemotherapy. A patient that is getting treated for cancer, that is when the loss of hair arises. So that is really, really important. Then, so any other disease? What about, okay, James, let's hear from James.
Okay, I'm trying to talk about diabetes mellitus.
Okay, talk about it.
In type 2, we have hunger, fatigue, and then frequent urination.
Yeah, that's very good. That's very good. So you are getting the clinical manifestations now. So let's still talk about another disease again. I really want you guys to get it. So who knows another disease again with the clinical manifestation? Anybody? Okay, who knows?
Hepatitis B.
Hepatitis B, good. So what are the clinical manifestations of hepatitis B?
Liver damage.
Okay. So now, no, I won't take liver damage as clinical manifestation because the patient will not see that liver damage. You understand what I'm trying to say? What will the patient feel? That is the clinical manifestation. What do you think a patient with liver damage would feel? Anybody? Who has an idea? Rosalind, yes. Let's hear from Rosalind. There will be accumulation of what?
Increase in cholesterol.
Okay, increase in cholesterol. Mercy.
Jaundice.
Yeah, jaundice. How does jaundice? I know you are very right, but do you know how does jaundice arise? It's really important. You can get 3 marks for saying jaundice, but you can get 5 marks for telling me how jaundice arises. So, do you have an idea of how that happens?
I think because of the bile.
Yeah, the bile. Yes. Somebody wants to add something?
Bile accumulation.
Bile accumulation.
Clinical manifestation. Nausea.
Nausea.
Yellowing of the skin.
Okay. Now you guys are really getting the gist. But do you think if somebody is focusing on those symptoms alone, do you think we can actually establish a diagnosis? No, because many of those conditions are actually non-specific. They are similar to other diseases. They are such that you can see in other conditions. So that is the reason why we can actually say that that justifies the need for laboratory diagnosis. And I hope you are able to figure that out. So any process that is non-specific, that is something that you can see in all the disease processes, that is not peculiar to what a patient is having, then that particular disease, that particular feature is, I have an international call, sorry. Hello? Okay. Hello? Let me be done with you guys. Yeah, sorry for that. Now, so that is it for general pathology. And but for systemic pathology, you have disease processes that are specific. So what I'm trying to say is that whenever you are discussing a disease, any disease that you want to discuss, you should actually understand those peculiar key elements of that particular disease. And so Mercy, so you should understand those features of those particular diseases. Mercy, do you want to say something?
No, I'm okay. Thank you.
Okay. Now, so that is that for general and system pathology, and the kinds of questions that we can be answering because of the format of the MCQ is so you should be looking forward to. So if a question comes out under general pathology, your key answer will be: is this thing only peculiar to this particular disease, or this feature is something that all other diseases have to deal with. So that is something that should always be at the back of your mind. So when you see a question on general pathology, you should be more specific about whether it is peculiar for that disease. So that is something, if I say, okay, so and so is a clinical manifestation of general pathology. So those features would not be, that particular feature would not be peculiar to one single disease process alone. It will be something that, oh, you guys are seeing my screen. So it will be something that would be affecting all other disease processes. So that's something I wanted to gain. Then for systemic pathology, because there is no theory in this question, you should also have that at the back of your mind, that it will be something that will be peculiar to that disease alone. So it'll be something that only this particular disease exhibit. So that's something that I really, really want you to be able to have at the back of your mind. So, and remember I said you guys should read each other's works, your assignments. So because we have to set 100 questions, we are more likely to, it's more likely that you will see those individual assignments coming up in MCQs. So please and please share your assignments, because I can't think of 100 questions without using your assignments. So please and please, that's something that I would also like to say. Then before I go further, please and please, if you have any question, any part of the work that you don't understand, this is your time to raise up your hand so that we can treat it collectively and I can deal with it. I'm seeing Onyebu's hand up. So Onyebu Alpha, what can I do for you?
So some of us are not doing histo, and then you're saying we should read each other's work. Yes, which work are you talking about? Is it histo assignment or cytology assignment?
The one that affects you. If you are doing cytology only, register, go and read up cytology assignments. Exactly.
So please, I should read all the cytology assignments. What you're trying to say?
Yeah, don't kill 100 questions out without your assignment. There is no, we have to work together now. So please, just read what you have. Then the group leaders in each of that group, get your assignments across to the course rep, and Chidera should get them across to me too. So that is just to let you know that your assignments are coming out. So Rosalind, I'm seeing Rosalind's hand up. Rosalind, do you want to say anything? Then Faith Benedicta, do you want to say anything?
Yes, sir. For the BRCA one that you gave us and BRCA 2 for breast cancer, should we read that one? When you said we should read on it.
Please do. But I will not ask a question that I know will be beyond your capacity. So please do read it up. Exactly. Then who else wants to say something? I'm seeing Precious and James. I think he has gone away. Who else? I think, am I seeing any other hand up? Yeah, so that does it for your, but please and please do your part. Nobody is out there to catch you. I'm not interested in failing anybody except you are truly deserving of failure. And okay, just like your Agbo.
Ask concerning the gene genetic and chromosomal analysis. Like that topic, I don't really understand the topic and wait. So are we to read that one too?
This is what I'm going to. Do you have a copy of the topics that we're expected to take in each of the courses? Do you have?
No, sir.
Why now? So I'm talking about the topics in this book. Do you have?
No, sir.
And what I'm going to do is I'm going to share that with course rep. Is going to get them across to you. So please and please, anything outside that, if anything outside that will be coming out, it will not be too hard. Maybe it was because I mentioned it. So it will not be something that you cannot handle. Is that clear?
Yes, sir. Thank you, sir.
Then Faith Benedicta, your hand is still up. Do you want to say something? No, 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 no. Let me lower our hand. So Rosalind, do you want to say something? No, let me lower our hand. Then James. Mr. James. Yeah, so that is, I think, all about it for now. Then for people in cytology, Buluatife. I think I should just move everybody now. Okay. Now, for those for cytology, we are going to also have to do with yeah, something is happening. Let me rehab you guys.